I'm Dr. Sarah Madad. I'm New York City Health and Hospitals Director of the Systemized Special Pathogens Program. And as we are, in the middle of a severe flu season, I engaged Asper Tracy, knowing that they are the gateway of various resources for emergency preparedness. And so I reached out to see if they had any templates or tools related to flu seasonal management. And I'm going to hand it off to Dr. Sean Studer to provide some more information.
Thanks, Sarah. So I'm Dr. Sean Studer, the Deputy Chief Medical Officer for NYC Health and Hospitals, and really what we were looking to learn is how to set up a surge space. We have abilities already to flex within our buildings, staff spaces that are not fully staffed, but leaving the building and working in tents, working in pop-up structures is not something we have a depth of experience yet. So we're seeking the ability to do that and learning from others, so hopefully we can skip some of the early mistakes that we might otherwise make.
Great. And let's see, in terms of what you've learned since starting this endeavor, what do you think are the things that are at the top of your mind in terms of how you plan to implement a surge facility?
I think one of the first things for us is we would like to try to do it sooner. We don't want to be forced into it at the moment. It's absolutely essential. We'd like to try to get it up and running and really pilot it a bit with our staff. So even if it's not needed at a certain facility, that might be the time to actually try it. So when it is needed, we've been through some of the lumps and bumps and can have a smooth process.
Yeah. And we were able to engage different healthcare systems like MedStar and Grady through the help of Asper Tracy to look at some best practices and any tips and recommendations they have for us.
Yeah, the advantage for working with Lehigh Valley is the proximity to us, the fact that they're quite experienced in doing this year over year, and that when we set up our space, we might actually be able to get them to come in and give us some real-time advice about what we could do better.
Produced at U.S. taxpayer expense by the U.S. Department of Health and Human Services.